Please listen to this lady and let's have human sympathy. All I want us to do is to help to push this video like she requested, that any means we can push her video to get to the people that we act, that is the government that will be responsible for solving the challenges she's bringing out, that we should do. That is exactly what I'm doing. This is not all about content. Please, humanity, for humanity's sake, to assist those that are sick. If you are not sick, you don't know what God has done for you. She has cried out. She enumerated a lot of things. She even gave examples. She gave directives. If she's lying, how to check. Please, let's forward this video. Let's repost it so that I can get to the appropriate quarter for the issues to be resolved. The least the government can do to those that are sick, or the least we can do to those that are sick, is to pacify them, is to put smile on their face, is to do things that will make them forget that they are sick. You can imagine someone is sick and facing trauma again. You are sick, and even what you are facing at place of treatment is even another hell. You can imagine that. I feel her pain. I feel the pains of every other patient that are in those hospitals, those facilities. Please, let's forward this message. Even if we cannot do anything, this video, let's forward it. Let's forward it mass.
Nigerian doctors are on strike, in case you don't know. Now, while it's easier for us to say that, you chose this profession, when you get to the gates, hang your problems at the gates, go in there and give your best, I also think that is unfair, especially if that working environment does not give you so much to be happy and fulfilled about. What I'm about to share with you is my experience as a patient currently undergoing treatment for cancer at the Federal Medical Center, Jabi, Abuja. The whole medical team that's managing my condition, from Dr. Popola to Matron Mark to Dr. Adamu to Nurse Vivian to Nurse Ruth, they are amazing. They know their onion. But the big question here is, who looks after these people? They come into that ill-equipped facility every single day, attending to people with extreme conditions, and at the end of the month, you don't pay them, or you pay them peanuts. And you cannot even say they don't generate enough money for them to get paid. Because I'm telling you as a patient that the amount we have to cough out at every appointment is unbelievable. And don't even get me started on the infrastructure of these facilities, because I'm mentioning FMC Jabi so that you can go and confirm. Patients, we have to sit at the corridor outside. That's our waiting area outside. I can't tell you how many times rain has started and ended on me as a patient sitting and waiting to see my doctor on clinic days. Yes. Let me now tell you about the doctor's office. The entire oncology unit in FMC Jabi is the size of a gateman's room. And that office accommodates at least 7 or 8 people, if I'm not mistaken. Then patients also have to walk into that same room to be attended to. Picture that. How do you expect somebody to be in that environment and every single day, and you don't pay them at the end of the month? Show make sense. Heck, what am I even saying? Until a few months ago, we did not even have a designated ward for chemotherapy. The porter has to go around and look for vacant beds in wards before we can be taken in and administered chemo. It was until recently they gave us one small hall like that at the back where we now go in for chemo. Does it make sense? Dear Nigerian government, I'm standing in the gap of other patients across the country, and I am begging you, please pay Nigerian doctors what they are owed. Improve their welfare. Improve the facilities these people come into every day to attend to us. It's bad enough that we are paying such huge amounts for healthcare, and still we cannot access qualified medical doctors. Please now, help us, please. I really need this to go viral, please. We're going through so much. I know I come on here and I'm trying to be positive, but you guys, You do not know what I'm having to endure. Trust me, please. Anyhow, this is going to get to whoever needs to see it. Please help. Thank you.